In mid-stages of dementia, some form of assistance with daily care is usually required. At this stage, many are still able to do their own care, but require more time and cueing. Try to do oral care in the bathroom if at all possible, as the sink, water, counter, and toiletries also serve as cues. Prepare your supplies and know ahead of time whether or not you will use toothpaste. If there is a swallowing problem with the foam produced by toothpaste, use only a moistened toothbrush.
Excuse me, Dirk? Dirk?
Leave me alone.
Never awaken a resident for oral care, as this may cause agitation.
Okay, I'm sorry to wait. I'll come back later. Hi, Dirk. Dirk, I have to brush your teeth.
Doing oral care at a better time and with a positive approach will make things much easier for both the resident and you.
Okay.
When working with someone in a wheelchair, pay attention to your body positioning.
Can you open up your mouth?
Stand to the side and slightly behind the person if you are providing care.
It's gonna brush your teeth.
To avoid being bitten, fingers should be placed only inside lips or cheeks.
Instead of my finger.
The two toothbrush technique is preferred for residents that have a difficult time keeping their mouth open or who tend to bite down. Remember to coach and cue the whole time.
Leave me alone.
If the resident begins to grab or clutch, try placing a rolled-up washcloth in each hand. If they continue to grab, explain what you are doing, slowly, softly, calmly, and reassuringly. If the resident appears to be becoming more agitated, have your care partner assist you by holding the resident's hands and continuing to speak calmly to them. Only one person should speak to avoid confusion. If the resident's agitation continues to increase, leave the room and come back a little later to try again.
You're doing so well. Thank you so much for letting us do this.
I'm going to take your dentures out, Patricia.
Residents with full or partial dentures should have their dentures removed and cleaned at least twice each day.
Is that okay?
A regular toothbrush is still used to clean the palate, tongue, cheeks, and ridges of the mouth. Carefully bring the dentures into the bathroom. Then, place a piece of paper towel or a clean face cloth in the bottom of the sink and add some cool water. Should the denture drop, it will be cushioned and less likely to break. Dentures should be scrubbed with a denture brush and denture paste using cool water. A regular toothbrush is too soft and too small to properly clean dentures. Remember that plaque is sticky and adheres just as tightly to dentures as to natural teeth, so it must be scrubbed off. Simply soaking with a denture tablet will not remove plaque. Plus, it's best to avoid these tablets with residents with dementia. At bedtime, dentures should be placed in a container of cool water and left overnight. If the resident prefers to wear his or her dentures at night, then they should be left out of the mouth for at least 2 to 3 hours during the day to give tissues a chance to rest. Dentures should be labeled with the wearer's name. Professional labeling is best and can be done by a dentist or denturist, and there are also kits available to help nursing staff do this.